Hey you guys, what's up? I'm Ashley from heavenathome.org, and this is the Heaven at Home podcast, where my goal is to encourage you in your personal growth journey while being open, honest, and owning my story. We have faith-based conversations and tackle a bunch of different tough topics. Check out the description to follow me and learn more. Remember, you are fully known and deeply loved. Let's do this. All right, hey guys, so we're with Amy, and first off, I just want to let the whole world know how thankful I am that she said yes, and I'm so thankful for her willingness to share some of her insight. Today we're going to talk a little bit about how to start therapy and a little bit about what to expect when you're starting your sessions or going through your sessions. We know that there are some practical growth tips that we can apply on our own, but there definitely are some things in life that do require us to walk with someone through our process. So, Amy, I was just wondering if you could just start off by sharing a little bit about you, your family, your school, or just anything.
Yeah. Thank you for having me. That's nice to be on this podcast with you.
Boop.
Yeah. Well, my name's Amy, obviously. I am an LCMHCA, which stands for Licensed Clinical Mental Health Counselor Associate. So I've been doing this for about a little under a year, but I've been working with the different populations for, I think, 2 years,
Awesome.
through internships and stuff. Yeah. I have a husband of 6 years and a cute little dog. He's 5.
Nice.
So that's just a little bit about me.
Awesome. Yeah, and I remember talking with you over coffee, and you mentioned that whole internship process was very in depth and stuff. So
Yeah.
all right. So I think a lot of people get kind of hesitant when they're considering starting therapy for a lot of different reasons.
Yeah.
But I think a big part of that is just not knowing how to go about it or where to look and stuff like that. So I was just wondering if you can kind of share a very simple process that people can.
Yeah, that's a good question. So if you think you might be interested in counseling, going to counseling, I would recommend people just go for it, don't hesitate. But then how to get that process started, this is really, really simple, but what I would recommend is just typing into Google counseling centers near me, or if you want a specific counseling center, if you want a faith-based counseling center, type in that your faith, and then counseling center. Or Psychology Today, that's another good one. Kind of to find, because on Psychology Today, we write a little bit about ourselves so that you can kind of get a feel of who we are and kind of our professional focus. So you can kind of use that to base off what you're looking for. Okay. So that would be my first guess, or my first piece of advice maybe. But then just go in with questions. If you don't know how it works, send your potential therapist an email hey, I'm interested, but I have no idea what I'm looking for, never done this, and I know that I would be happy to reply and be well, let me help you through the process. I think
and getting in contact with you guys was super easy on this website. I did have a question in case someone was communicating with their doctor regarding things like depression or anxiety or some other thing. Is it also possible to get a referral even to a Christian-based place or just in general?
Oh, that's a really good question.
I was wondering about that.
Well, I know if you talk to your doctor, I don't know if all doctors, but I talked to my doctor about when I was having some anxiety, and they hooked me up with a little bit of medication, but also they hooked me up with a counseling referral automatically. And that was really helpful for me because I didn't really know, I was new to the area, I didn't know where to go. So I know that if you talk to your counselor or your doctor about that, they should have some counseling centers already in their database.
Okay.
So they should be able to refer you. I don't know if they'll be particularly faith-based, but you could ask. And then the same is true if you're going to counseling and you're interested in medication, because counselors don't prescribe unless they hold they're psychiatrists. We typically have psychiatrist referrals ready and available to our clients.
Okay. What advice would you give for people that are getting started?
I think One thing that's really helpful that I will kind of tell you from my perspective, anytime a new client comes in, and this is across the board, whether you're Christian or whether you're not, anytime somebody sits down on my couch for the very first time, I make sure to ask them, what brings you in? So kind of prepare for that question. What brings you in? Why do you want to go to counseling? And then the next question I ask clients is, at the end of counseling, at the end of our time together, obviously not today, like that would be our first session, but like when you graduate counseling, what do you want to see differently about your life? What do you want to see accomplished? Because that really will give us the framework of what are we working towards and how will we know that we've accomplished our goal. And so that's really helpful, but it throws so many people off because they're like, oh, I didn't think about that. And that's okay. I feel like most people don't. But if you can have an idea of at least like, what do you want to see differently? It will really help you really think about what you want to do, what you want to talk about. It'll guide our sessions a little bit. So that's one or two things that I would think about before your first session.
Yeah, I mean, I just thought about that. Like, I feel like it's really important to have a goal, like something like kind of practical that you're aiming toward.
Before we move on from that,
Yeah,
goals are great, and I highly recommend them. And in the counseling world, we want to have them as therapists because we don't want to just keep stringing you along. So ethically, we want to have goals for you. But at the same time, a lot of people come in and they're like, well, I don't know. And that's okay. Like, we can work on them together. We can decide what you want to do together. So you don't have to have the answer for you to come in. We don't need that. And if the goal changes, we can address that too. Like, there's nothing wrong if we think, oh, I want to do this, and then 3 weeks down the line, you're like, actually, I don't want to accomplish that. I want to do this. That's okay too. So you don't have to have the answer to come in.
Yeah. And then, so for Christians in particular, do you have any advice for them as they're starting therapy?
Yes. Be open to the process. I think when we talked not long ago, we kind of talked about like how Christians are amazing. Like, we have Jesus at the center of our lives, and that like really is powerful for us. But I think in the church community, sometimes we experience very close-minded like thought processes, I don't really know, in the sense that people will come in and they'll think counseling can only look a certain way, or sometimes they think like, as a Christian counselor, they're expecting me to just tell them to pray about it more, which can be very damaging to a lot of people. And so, like, have an open mind. We're going to explore tons of different elements of your faith if that's what you want to do. So just come in with an open mind. Be open to the idea that God works in amazing and different ways. It doesn't look the same for everybody. So that would be my number one piece of advice.
That's really good.
Yeah.
What about, again, like kind of general, kind of navigating through that process of finding a therapist? Do you feel like how do you think people's attitude should be about that? Like, should they give therapists time or like to get used to each other? Do you know what I mean?
Yeah. That's a really good question. Well, we're seeing a trend right now. As therapy and mental health is becoming more talked about, which is really important, what I'm seeing a lot of is people going in and meeting their therapist, and they're like, I don't like you, and then they'll ghost you. And that is evidence of not very good communication process. And so if you're not clicking with your therapist, there's nothing wrong. Doesn't mean that's a bad therapist, doesn't mean you're a bad client. It just means maybe you guys aren't clicking. But instead of ghosting the therapist, you can do that if you want, but what I would recommend and what I tell my clients at our first session is like, I don't know you, you don't know me, therapy's weird. So if you're feeling uncomfortable at any point, communicate. I invite you to tell me what's going on for you. If you feel like I'm sitting here judging you, or if you feel like we don't mesh, please let me know so we can talk about it a little bit. My feelings will not be hurt. I just want to get you the best therapy that I can, and that may not be with me. But if you're like, hey, like, I don't feel like we're clicking, I would recommend give it like 3 to 5 sessions. But even if you feel like before then, like, I don't want to be with this therapist, let me know so that way I can come up with like 3 different referrals for you. Because I want to hand you off to someone who will be a good fit. I don't want you to just be like, oh, I've got to do this by myself. You don't. Even if you don't like me, that's okay. I can help you get to the next one, whoever that might be.
Yeah.
So I would highly recommend that.
Okay.
Communication, I guess, really.
Yeah, like being straightforward about that. Are there certain things, or is there anything else, I guess, that people might need to know about, like the process of therapy? I guess like during a session or after a session, some things that they might need to wrap their minds around, or
Yeah, that's a really good question. Oh, there's so much. I think we've talked about it briefly, but and I don't know if this is the direction you want to go in, but
wherever we go.
Okay, cool. So stuff's gonna come up. Like my role as a therapist is not to change your situation. I can't change anything for you. I can't do the work for you. So you have to come in knowing, like, I'm going to talk about hard things. I'm going to probably have to face things that I've been trying to avoid for who knows how long. And I might have to feel my feelings, which I love when people feel their feelings, because that's the work. That's the hard stuff that a lot of people avoid. So I'm going to tell you to feel your feelings. But at the same time, know that, like, you have to do the work. I can encourage you. I can provide you with the tools. I can help you see a different perspective, and I can empathize with you. But at the end of the day, your situation will not change unless you put in the work. So
they can't have an expectation that, okay, I'm gonna be fixed.
Right. It doesn't work like that. It's some people rarely will be like, we'll do like 3 to 6 sessions, and we'll be like, all right, good to go. That's for really, like, I would say rather simple problems, if you want
like
to
a little bump in the road.
Yeah, maybe like a little bit of an adjustment issue. But like for most clients I see, it's more long term, because what is really happening is they're avoiding things. They're running from them instead of facing them, and maybe they're afraid to face them. So we have to talk through that fear. We have to learn how to face that fear. We have to learn the different ways. There are different patterns in relationships, and that takes time. So I would just expect, or I would go into it. 1, communicate with your therapist. 2, prepare to feel stuff.
What should someone do if they're in the middle of a session and they kind of get emotionally triggered and kind of like freak out on the inside? Is there like some kind of coping thing you might recommend?
Yeah. If you're in the middle of a session, it's a great time to get triggered. Not that I want anyone triggered, but a lot of times we do have to activate those emotional responses that we tend to get stuck in. And it's kind of like the best place to get hurt is in like a hospital or in front of a hospital.
Oh, wow.
Because the people in the hospital are trained to take care of you. So the same idea is, if you're going to get triggered in your therapy session, communicate to me or communicate to your therapist what you're feeling. And reality is, most of the time we will notice what you're feeling, because we're watching not just what you're saying, but we're watching your body language. We're looking at how you're responding to us. And so if I see a client having a reaction, whether they're crying or whether they're shutting down, I'm going to try to like tune into that. I'm human, I might miss it, but I'm going to try to tune into that, and I'm going to be like, what's going on for you? And if you can verbalize it, great. If you can't, that's all right. Let your therapist know, like, hey, I don't know how to use my words to tell you what's going on.
That's really good.
So we can kind of talk through it. I've got some really great coping skills, depending on really what it is, to help you work through that emotion.
Yeah. Okay. I do have a couple more questions regarding therapy.
Yeah.
I don't want to put this in the part 2. But what should people expect in therapy sessions that involve like multiple people? So if it's within a family or a couple who's married, or a group session, I know you mentioned that, like what should they expect from that?
Oh, that's such a good question. So Each thing you mentioned, like group, family, couples, each of those have their own different like feel. So I want to say a little spiel about groups. A lot of people, like, they're like, I am not doing group therapy. Why would I do that? Just putting a little aside about groups for anyone who's interested. Research indicates that group therapy is as effective, if not more, than individual counseling. And it's really powerful because part of group is like watching other people be vulnerable encourages us to be vulnerable, and when you see somebody else having a breakthrough, it makes you want to have your breakthrough. So it's encouraging you to do the work. And also it's like I'm not alone, because a lot of times we wrestle with things of like that we feel super shameful about, or we're like, I could never tell anybody else because they don't feel this way. Well, first of all, that's not true. I guarantee you, like, at least one other person feels the way you do. And group allows us to access those people, and is a powerful, powerful tool. And there's different types of groups, but groups are great. The other thing I would say, like if we're talking about family counseling or couples counseling, I think primarily what comes up in that regard is a lot of couples and a lot of families experience conflict and they don't know how to break through that conflict. So that's what brings them into session. And so we are going to start looking for patterns in the family or patterns within the relationship. And as a therapist, I'm going to start looking for what you're doing in the room, because it's very likely that you're doing that outside of the counseling room. So I'm going to try to point that out. So many different therapists have so many different approaches when it comes to couples counseling or families counseling, and I am not an expert in either of those counseling fields, but I would just be prepared to communicate, be prepared to face the things that you have been avoiding.
Really good, really good. So there's one question, because this is something that I previously experienced when I was in counseling, which I will be starting again soon. But yeah, you're good. Okay. During a session, so let's say there's someone on the chair, and sessions are usually like an hour.
It depends on what you're doing, but yeah, it's like a 50-minute hour.
Okay. So what should someone do if they notice that toward the end of the session, like they were on like the precipice, or like they kind of had that quote unquote breakthrough moment, or like realization of something that was happening internally, but they have like that sensation of kind of like being left hanging a bit? How, like, what would you recommend for them to, like, how would you recommend they wrap their brain around that, number one, and then kind of work through that until the next session?
Like, let's say they're like, they hit that breakthrough or that aha moment, and then their therapist was like, all right, we gotta go. Like, yeah, that can be really hard, and that does happen. And so it's hard. If your therapist recognizes it, we try to bring, like, tidy it, like wrap it up like a bow, and like send you out so you're ready to like bring that and unpack it next time. If they missed it, which is also, it happens, we're human, let them know before you leave the office. Like, I just feel like I got this aha moment. It really like opened my eyes. And so if someone were to say that to me, I would be like, if you could tell me, what did you see, what did you find, what hit you, and then I'll kind of say like, all right, that's so important, and I want to talk about it with you next week or whenever you're here again. So if you would, I want you to journal about it, or I want you to, whatever your form of getting it out is, and processing it in between now and your next session, and then come back with that journal, or come back with however you processed it, so we can talk about what else you did with it and what happened. And so that way we really can, in a way, put a bow on it, and have you continue to do the work outside of the room, and that way the next time we can start with that.
That's really good. Okay, what about like kind of an opposite scenario where like the session is kind of coming to a close? If someone's in a session and they've had to remember and unpack a bunch of stuff that happened previously, but there's like so much they almost feel like unresolved. Like what would you recommend for them? Would it be the same or different?
It depends. It really depends. I don't know if this fits the situation, so you tell me. But I was in a counseling session once and we were really talking about, and I was the client, and we were talking about some really heavy things that had brought up a lot of like emotional triggers for me. And so I was feeling flooded with emotion. And my therapist could see it on my face. She knew. She was in tune with me. And so we had kind of come to that last 50-minute mark. And she had to go, and that's fine. And so she encouraged me to, she was like, how are you going to take care of yourself between now and next session? And I love the way she did that, because she put the responsibility of my self-care on me, because that's, as a client, that's your responsibility. But she was the one who brought that to my attention of, you've just felt and you're feeling these really heavy things. That's part of life. That's normal, and that's good because you're feeling them. Yet you have to go function. You have to go to work. You have to continue. What are you going to do to make yourself feel, I don't want to say feel better, because we don't avoid emotions, but how are you going to walk yourself through that? And she gave me different ideas of like, take a walk or listen to some music, the basic things that we suggest people do. I mean, it really got me thinking about like, when I'm feeling, I don't want to say too much, but when I'm feeling a lot, what do I do with that? And I don't know, does that hit your question?
Yes.
Okay.
Completely. Okay, that's really good.
So that would be what I would recommend, is think about like, how are you going to take care of yourself? What are you going to do that allows you to feel this emotion, but allows you to be okay after?
Awesome. And then I think this is just my final question.
Okay.
Because I think a lot of people may have thought about therapy, but are not quite sure that they need it. What would you say to someone like that? Or like, are there some things that people can look for, reflect on in terms of their behavior, or maybe just their life, or anything?
So when I was going through counseling when I was a teenager, I had this stereotype, and I've evolved since then, thankfully. But I had this stereotype of like, only people who have like severe mental illness go to counseling. And so then when I went, I was like, I don't have severe mental illness. Like, what's going on? Like, why do I have to be here? And then towards the end of my counseling sessions, maybe towards the middle, I was like, oh my gosh, like everyone should go to counseling because it's amazing. And so like, if you're thinking about counseling, even if you don't have the like maybe like a really impacting diagnosis, or maybe you don't have like really, I would say like big quote unquote problems, if you're thinking about it, give it a shot. Because counseling is for everyone and anyone. It's a powerful tool. And just talking through like, hey, even telling your therapist like, I don't really know if I need it, but maybe there's some things I would like to see differently. Like, great, I can help you with that. We can sit together in that. So I would just recommend like, give it a shot. But also like, if you want something more specific, look for patterns in your life. If there are certain things you get triggered around, or if there are certain forms of communication or ways people talk to you that really bother you, and you see that showing up a lot in your life, then I would just recommend maybe talking to a therapist about it, or just going to see somebody and talk. Just tell them what's going on. So that's something I would suggest.
Awesome.
Yeah.
Thank you guys so much for listening. Feel free to DM me to send me your feedback. Check out the description below to follow me on social media. This podcast is listener supported. Don't forget to subscribe. Remember, you are fully known and deeply loved. I'll see you in the next one.